Hi, I'm Laura C, and I'd like to talk about digital health surveillance and how people's fear of governments accessing their data is stopping them from using apps that can potentially save lives. I've recently been following the COVID-Safe app. It's a contract tracing app released in Australia in response to COVID-19. I don't have a position either way on the app. I haven't downloaded it yet. That's mainly because I'm busy with work and kids and study. It hasn't reached the top of my to-do list yet. But I've got friends who've downloaded it and others who have refused. So how does it work? The Australian Department of Health website says that once you've registered and downloaded COVID-Safe, the app creates a unique encrypted reference code, so you can't be personally identified. When it finds another user over Bluetooth, it notes the date, time, distance, and duration of the contact. The information stored on your phone is then deleted every 21 days. If you're diagnosed as having COVID-19, your state or territory health authority will request access to the app. If you agree, the data then will be uploaded and they will start tracing and contacting people, but they won't reveal your name or any locations. This is a level of privacy people in other countries don't always get. In Australia, the contact tracing app is voluntary. The government's hoping about 40% of Australians will download it. So far, about 6 million people have done just that, but that's about 25% of us. People download content and apps all the time that collect our data without really looking at the fine print or understanding who really is collecting it or where that information is going. Yet, when it was announced the government was introducing a contact tracing app, there was a lot of controversy about it. People were asking a lot of questions about how the data would be stored, where it would be stored, how long it would be stored for. These were questions that were rightly being asked. It didn't help that the government didn't have a lot of details available at the time the app was launched. In fact, many of the laws surrounding the app's use weren't agreed on or enacted at the time that it was first available for download. Some of the details are still a little vague for people's liking. The legislation written for the app says that data collected will be destroyed when the pandemic finishes, but there's no time frame or really any guidance that says what constitutes the pandemic finishing. From talking to friends, it also appears some of the concerns come from our government's track record on data collection and data security. The Australian government's My Health record was introduced 8 years ago now and was plagued with privacy and security concerns from the start, to the point where people were given the option to opt out. In 2019, it also suffered a serious cyber attack. It's really only recently started to gain some momentum. So is the issue really about the app itself or about who we are giving our data to and our trust in them? If a local community organisation with a lot of community trust, like the Salvation Army, the Cancer Council, the Australian Red Cross, had developed the app, would the reaction be different? Would more people be downloading it? It's unfortunate if this is the case because this type of digital health surveillance has a lot of benefits for the community. I'm interested to hear your thoughts on this. Let me know in the comments below if you have or haven't downloaded the app, and if you would have changed your mind if it wasn't a government app.